那个 line 不好。
Yeah.
Where are you from, Mrs. Wong? Can hear
I'm
us or
under
not?
Sunny Kwa. Can you hear me?
Sunny.
Sorry,
Oh, Sunny Kwa.
Why? Yeah.
Sunny Kwa is KL, right? Sunny Kwa is KL. Yeah. Sunny Kwa is in KL.
You, I'm from Klang.
Oh, you're in
Sunny
Klang.
Kwa is staying in.
Can't hear?
Yeah.
Oh, okay. So how long are you with vantros?
I've been using the product only, so now I want to learn a little bit more about the product, especially the IM laser.
What do
Can
you
hear
say?
me?
You cannot hear or what do you say? What do you say?
去抓那个门的鞋子，其实我的衣服在这边。
I say I want to. I've been a user only.
Oh, user only. Welcome to our health talk. You will be fascinated about our speaker with his knowledge. You have a lot to learn, especially we ladies having a lot of health issues.
Yeah. That's why I'm here to learn.
Not only learn, after you learn already, try to be one of the active one. It's a good business to be in.
哦，看到了。
Oh, we have got 10 attendants already. Slowly increasing. People work today.
Yeah.
Because it's a Friday. Yeah, it's a Friday.
Mr. Lee
can see Mr. Lee already. Yes, I can see Mr. Lee.
Let Mr. Lee set up the screen.
Mr. Lee set up the screen first. Hi, Mr. Lee.
The line is bad. The line.
Yeah. Kiki Kokok. Hi,
Hello, testing.
Testing now. Okay.
Bad.
Yeah, very distorted. I can see you, Mr. Lee, now. Mr. Lee, taken your dinner or not? You cannot hear me. Mr. Lee, taken your dinner already or not? Ano bulat kong wa?
Cannot
Okay,
hear.
good evening. Can hear or not?
Good evening. So ready,
Mr.
can we
Lee.
start?
The
Mr.
audio,
Lee,
is it okay?
we don't see your share screen. How come got echo?
Hello.
Hello, Mr. Lee. Yeah, I can see you. But there is echo, in echo behind. Background got echo.
Hello, testing. 1, 2, 3.
Testing, can hear you. Yes, can hear you. Shall we start now? Okay, Mr. Lee, you want to start now? So I start introductory first.
It seems that Mr. Lee couldn't hear us.
Oh, Mr.
Yeah,
Lee couldn't.
can. I forgot to put on the earphone already.
Oh, okay. I thought something wrong with your side. Okay.
No wonder no response from you.
Yeah.
Okay, we start now.
Yeah.
Hi.
Yeah.
Okay, good evening, everyone, brothers and sisters in Vantros Healing Ministries. My name is Linda, and I'm your facilitator tonight. Okay, welcome to another sessions of Health Talk by our popular demand speaker, Mr. T.H. Lee. I'm sure everyone know him. He is a nutritionist by profession. Last presentation, he touches on 6 most likely diseases caused by endocrine disorder. He mentioned scientists and experts confirm that hormones balance plays an important role in maintaining our body health and beauty. He also spoke about what is endocrine system, which is actually a network of glands in our body that produces hormones to help our cells communicate with our organs and its function in our body. Okay, so tonight he will continue with endocrine disorder part 3. That is hormone imbalance that causes thyroid problem. Common woman diseases. Wow, ladies have more diseases than men. So ladies, sit back, relax, and learn as much as we can. Mr. Lee will also share our IM laser and CV8, how our IM laser and CV8 can help. Let us put our hand together and welcome Mr. Lee, our Lee Lao Shi. Mr. Lee?
Okay, good
Okay.
evening.
Good
Okay,
evening.
brother and sister in healing ministry,
Yes.
Okay, let me share my okay, let me share first, my screen. Okay, can see,
Yeah.
Can see or not?
Can.
Can, clear,
Yeah, clear.
Okay. What is this? Color scheme. Okay, so today we are going go into part 3 of this endocrine disorders. So I don't want to waste too much time. Repeat the earlier one. So we directly go to the important things. There's hormonal imbalance causes thyroid problems and some of the woman illness. Okay, so I will go into this. Not to say very in detail, okay, a brief introduction to what is it, so that you all have a brief idea, especially for ladies, like period problems and then the period function and then what is happening during the period, during the process of the period, what is happening to your body. You should by right, it's your responsibility to know what is happening inside your body. Okay, but so far, actually, I've been given this talk for quite some times. Okay, in many places, I find that a lot of women actually they are mong cha cha one. They don't know actually what is happening. Okay, they just know okay period is happening and then got some problem. Okay, all the hormone or why it happened and then why they have a mood swing, all those because of the change in the hormone and then it causes sometimes the period pain and then sometimes maybe have discharge or Virginia discharge, all those. So by right, or everyone, okay, especially women, should know all these basic things because that is your body, okay. And here I will give a brief explanation on that. I hope you can learn it up because so far maybe okay you learned before, but you have maybe or sometimes you have forgotten all these things. So we go into thyroid first because thyroid is one of the very common diseases among ladies. Then ladies of my experience, hyper, okay, and then I also met a lot of people who have this kind of problem, but they really don't understand and sometimes not clear about what type of thyroid they are having. And then that's why sometimes when they want to do some therapy or want to take something, they might not taken the correct things. Okay, because thyroid, or when we talk about thyroid, there are basically 2 types of thyroid. One is hypo, one is hyper. Okay, and then in common, there are few diseases which are normally caused by this what we call the immune disorder. whereby our immune system is attacking the thyroid, okay, and cause these two illness. One is called the Hashimoto diseases, and then the other one is called the Graves diseases. So this Hashimoto diseases actually is referring to hypothyroidism. There is a lack of release of this thyroid hormone. Okay, the T3, T4 is a deficiency in the body. Okay, because of our immune disorder attack the thyroid system, it causes this problem. And on the other hand, Graves diseases, okay, is the hyperthyroidism, whereby also caused by immune disorder and attack the thyroid and make the thyroid didn't function properly, okay, and make the release of all this T3, T4, the hormone getting very high in the body, and then it causes a lot of problem. So there are basically two types of thyroid. If you have thyroid problem, you must make sure you understand and then you know which type of thyroid you are having. Okay, otherwise you will maybe practicing wrong therapy and then wrong way of treatment, and especially when you are using IM laser, okay, different type of thyroid, you might apply different way of use on the IM laser. And then because some of you might thought that if I got thyroid problem, then I put on my neck there lah. Okay, the thyroid gland there, that is okay. Not the true. Okay, only certain type of this thyroid like hypothyroidism, you can put I'm laser on the thyroid gland there. Okay, otherwise like hyperthyroidism is not encouraged to do so. Okay, the treatment will be totally different. Okay, because it's already hyper, and our IM laser, the function is to stimulate or sometimes. So it's not easy for the thyroid to automatically adjust the release of the hormone because there are many factors which will affect the release of thyroid those T3, T4 in your thyroid gland there. So this stimulation sometimes will make the hyperthyroidism get worse one. Okay, so it's not encouraged to put on your thyroid gland if you have hyperthyroidism. I will teach you how to use the IM laser, okay, to do some therapy to overcome your hyperthyroidism problems. Okay, so these are the few things you should know, okay, to decide whether you are hypo or hyper. Okay, by right, you should consult a doctor, okay, to see what is happening, and then you get exactly what type of thyroidism you have, either hypo or hyper. But for some cases, some people, even they have seen doctor, they still don't know what, or maybe they still didn't go to see doctor, even though there are symptoms coming out, and then they cannot identify whether it's hypothyroidism or hyperthyroidism is under process. Okay, so these are the symptoms that you have to look into, okay, when you have hypothyroidism. So basically, some people, they might thought those people who got a swollen this neck here, okay, got some become thicker and then swollen there, they indicate hypothyroidism, but that is not true. Okay, no matter whether you are hypo or hyper, this symptom might happen. Okay, both. Okay, because inflammation might happen to your thyroid gland, and then it make this swollen happening in the thyroid gland there. Then it looks like bigger, thicker from outside. Both hyper and hypo also will have this kind of symptoms, but majority it happen in hypothyroidism lah. Okay, so you must make sure don't judge the thyroidism using this method alone. Okay, so there are other symptoms you can observe. Okay, let's say for hypothyroidism, normally your metabolism will be very low because the release of this hormone T3, T4 is very low in the body, and then it causes a low metabolism. So, okay, it will cause and lead to this kind of problem. Dry cause hair, okay, your hair become very dry. Of course, if you are doing a lot of chemical treatment to your hair, let's say you want to change color or something like that, okay, then it causes a very dry hair, then there is another, then you cannot, based on this to judge whether you have this thyroid problem or not. Okay, so mostly they will have loss of eyebrow hair. Okay, this is quite obvious for those who are lack of this hormone release of thyroid. They might experience loss of eyebrow here, eyebrow hair. Sometimes you might observe some ladies when some elder okay, they will begin to lose their eyebrow hair because the degree or the volume of hormone released by the thyroid is slowly getting down. And then, okay, the growing of all this hair in the body will get slower, and then some will cause the eyebrow to lose the eyebrow hair. And then this puffy face, that means the retention of water might happen. Okay, and then your face look slightly a lot of water like retained on the face. Okay, this puffy face may occur. You look more fat. Okay, sometimes even though you are not that fat, but your face look fat. Okay, and then enlarged thyroid, what we call the goiter lah. Okay, just I already mentioned, and then you might experience low heartbeat. Your heartbeat, normally common heartbeat, maybe is around 70, okay, 70, 80 something. Okay, maybe some people they slightly lower, also 60 something or up to 80 something. There's the range. Okay, then if you have hypothyroidism, maybe you will be all the time have a very slow heartbeat, maybe sometimes below 60, okay, or just around 60 something, never touch 70. Okay, these are one of the symptoms. And then you might suffer from arthritis sometimes, and then you cannot stand very cold weather, cold intolerance. Okay, slightly aircon, then you tak boleh tahan already. Depression, your mood is not that good. Okay, you always feel very down. Okay, depression and dry skin. Okay, dry skin, water it seems like cannot withhold. Then the skin like don't have any moisturizing oil. Okay, dry. And then fatigue. Okay, a long time you feel very tired because metabolism is very low, generating of this energy is low in the body. Of course, you feel very tired, and then your brain cannot work very in a very good way. Sometimes you might forgetfulness might happen. Okay, and then your weight, you might experience a very heavy menstrual period. That means during period the volume is very high, and then it takes a very long time to finish. That's we call the heavy menstrual periods. Infertility, that means cannot get pregnant very easily. Okay, and then maybe some of the muscle will feel pain. Okay, okay, this is most of the symptoms, and then in the long term you will have this weight gain because of your low metabolism. Okay, so this is the hypothyroidism. You must really go through it. If you have maybe 4 or 5 this type of symptoms, then okay, you might experience hypothyroidism. And on the other hand, okay, if you experience hyperthyroidism, okay, then you will have hair loss. Too fast, your metabolism. The hair also grow very fast. The old hair will drop very fast. Sometimes even faster than it grows. Okay, so your hair loss will happen, and then your eyesight, budging of your eyesight. Okay, cannot maybe cannot see very clear, and then sweating. Okay, abnormal sweating, even it's not very hot, okay, but you still sweating a lot or a little bit of a change in this temperature, or maybe makan a bit, okay, slightly hot things, then you sweating a lot. Okay, this is one of the symptoms of too high your metabolism. And large, okay, thyroid gland, goiter also, okay, and then your heart will beat very fast. Okay, so this is one of the thyroid hormone. Okay, it will affect the heart to beat very fast too. And then of course in the long term it will affect your heart muscle, all those. Okay, maybe it will cause heart problem, palpitation, and then the fast heartbeat, it will cause insomnia, very difficult to sleep. Okay, and then you are heat intolerance. Okay, so hypo one is cold intolerance, hyper one is heat intolerance, or you cannot tahan a very hot weather. Infertility, or cannot get pregnant easily also. And then irritability. Okay, maybe the sometimes might have sensitive skin, all those you feel uncomfortable one. Okay, muscle maybe will experience don't have strength, muscle weakness, okay, on the muscle there. And then nervousness, you feel not calm, or you feel nervous, and then sometimes it affect to have anxiety or those emotional problem also. And then this scan, that means very little menstrual period, very short and very little. And then weight will lose weight. Okay, and then of course your bowel movement. Okay, frequent bowel movement. Okay, sometimes you might thought your colon got problem, but sometimes hyperthyroidism may cause frequent bowel movement also. That means your colon cannot slow down okay, in a proper way. Always got some activity or moving, then it cause you to go for toilet. Okay, these are okay the all the what we call the symptoms. Okay, so if you have a Hashimoto disease, there is hypo, then you have hypo symptoms. Grave disease, just I already mentioned, these two types of disease is basically is due to immune system. So the treatment of these two, we have to do something on improving our immune system. Otherwise, you cannot actually fix it, fix the problem, or you cannot what we call recover back from this problem if you didn't really calm down your immune system, because it's a cell attack system problem. Okay, so normal type of this thyroid problem, it might cause by these few factors. Number one is the intake of iodine. That means from the food. If the iodine is too little, deficiency of iodine, then you might cause hypothyroidism, like Hashimoto disease. Okay, if excessive iodine, too much, that means if you like to take a lot of seafood, okay, sometimes maybe the salt intake is too high, okay, and then maybe those seaweed you're taking too much, then excessive iodine might cause hyperthyroidism. And you have to control your diet, okay, so to reduce your iodine if in that case. Okay, then second reason, the third reason, okay, why sometimes you might have thyroid, this thyroid problem, they might caused by this thyroiditis, that means the inflammation of gland, okay, cause and then it causes swelling. And this causes the growths to happen, or you look your gland there or your neck there, it becomes swelling like a bigger, and then this is caused by inflammation, either attacked by virus or bacteria, or maybe your circulation system having some problem, and then it causes inflammation, or maybe some injury or etc. Okay, that cause inflammation on your thyroid gland, and then this might lead to either short wire of your thyroid release of a T3, T4, either T3, T4 become higher or lower. Okay, it depends on every individual. Okay, and then a non-functioning thyroid gland, or the functioning is incomplete in your thyroid gland there, or either because like this Graves and Hashimoto is because of cell attack of your immune system lah. Then sometimes maybe you will have genetic problems which will cause the thyroid cannot function properly. And then finally, the disorder of immune system, of this endocrine system in your body, especially your hypothalamus, your pituitary gland, your pineal gland, all this the upper gland, okay, which will give instruction to the function of your thyroid gland. It didn't work properly, and then it released maybe instruction didn't give nicely to your thyroid gland, and then your thyroid gland also follow wrong instruction from the upper commander, and then it release wrong hormone, or wrong quantity of hormone, okay, and then it affect your body. So from here you can see the type of causes of this thyroid problem is basically your eating, and then maybe your immune system, okay, against some bacteria, virus, all those infection, okay, and your immune system is your immune system, and then your this circulatory system, okay, and then maybe sometimes the gland is deteriorate due to the cells in the gland is not that strong already. The energy level of your gland is deteriorate, and then it causes the gland cannot function properly. And then finally, it's because of the endocrine system disorder, okay, on instruction given by your hypothalamus and your pituitary gland, or the effect of pineal gland is not good, and then it causes this thyroid problem. So when we want to fix it, we have to go accordingly, okay, go according to all these factors, then only we can fix the problem nicely. So from here, this is a diagram to show you, okay, all the organs function in our body, especially when you see like hypo or hyper, their heartbeat will be different. That means, okay, from your hypothalamus, you will give instruction to your pituitary gland. Pituitary gland will release certain hormone to instruct your thyroid to function, to release certain hormone, okay, to instruct, to affect the performance of all the organs like heart, your liver, your kidney, and then your tissue inside the body. So if your thyroid is not functioning properly, then of course all the organs will be affected. Okay, so from here, we must understand the whole cycle, okay, the whole problem, okay, when your hormone system is imbalanced, then it will cause the communication inside the body between the brain and then the cells and then the organ is not functioning properly, and then sometimes it will lead to the absorption of certain minerals, or those will getting down, and then finally it causes another system to become disordered. That is our nervous system. So these two systems, your hormone system and then your nervous system is the communication system in the body, whereby the whole body system, other system like your muscle skeleton, okay, your breathing system, okay, your this digest system, or your muscle, your bone growing, okay, all these systems, they are connected, okay, through, okay, your endocrine and your nervous system. So if your endocrine and then your nervous system is not function properly, then instruction given sometimes might not be clear, might not be able to reach all other system, and then of course the other system cannot function properly also, and then it cannot complete their operation without the communication from the endocrine system and then the nervous system. So you can see here, if this hormone system and this nervous system get short wire, then the whole body will get short wire, and then of course, your inner doctor are made from all these system. The inner doctor also will start to get crazy, and then of course your immune system will get crazy also, and then there is the begin of all type of disease to happen in your body. Okay, so hormone system, okay, my imbalance might cause menstrual problem. So from there you can see, or if you have thyroid problem, definitely you will have menstrual problem also, because the thyroid, okay, will affect those lower part organs, those lower part glands, and then of course your upper part glands like your pituitary, okay, your pineal will affect the release of those hormones in your vagina or in your this sex endocrine, okay, sex hormone will be affected. So there are three kinds of period problems normally a woman may face. Okay, the first one is the this medical terms called amenorrhea. Okay, very difficult to pronounce. There's an absence of the period, or you might experience very irregular menstrual period in a woman of reproductive age. It means when you're supposed to have period, then you don't have period, or the period is really upside down, okay, not in regular, okay, the time and then the period, volume, all those are seriously affected. And then number two, okay, you might experience this dysmenorrhea, okay, what we call layman, we call painful periods, or including cervical cramps, okay, cramps, when the period cycle, okay, you will experience a very painful cramp, okay, until sometimes you cannot work. Some people even will seriously affect their emotional, and then sometimes even get fainted, okay, because of period pain. Okay, this is a true pain, very very painful. I will explain to you why it happens. And then the third one is called the abnormal uterine bleeding. Okay, means vaginal bleeding. Okay, due to certain reason. Okay, in normal day when you it's not because of period, during period cycle, normal days, okay, you might have this vaginal bleeding, or after having sex, making love, okay, there will be vaginal bleeding. Okay, then this might indicate some problems, okay, in the vagina there, and then you have to do something to rectify it. Okay, so the female these hormones basically these are the three major hormones which will affect ladies, okay, the estrogen, and then the progesterone in the woman's body. Okay, and then not only women have, actually men also, male men also, they will have this hormone, only the ratio is different. Okay, then like progesterone, all those are estrogen. Okay, it will be slightly different in ratio. Okay, and then this function how it function, and then how other upper gland that might affect the release of all these hormone in your this sex organ. Okay, of course, if men the testes here the ladies. Okay, so there will be connection between your this thyroid gland, your pituitary gland, and then your hypothalamus. Okay, so that's why sometimes your emotional problem might affect the release of the hormones inside the body, because there is connection. So if you always have problems, always feel angry, getting angry too much, worried too much, maybe it will affect your period cycle also. And then on the other hand, okay, disorder of this hormone in your sex organs will cause this what we call the how we call it, okay, the brain to relieve certain stress hormone, which we refer to those adrenaline, okay, and then the thyroid maybe it will affect the heartbeat, and then it will affect the release of certain hormone in the brain there, and then this will cause those how come the word cannot come out already, emotional problems like depression, okay, anxiety, all this. So there are two ways. Okay, some because of depression, anxiety, then it causes a period have problems. Some because of imbalance of this hormone cause period problem, and then it turn back it will cause all this emotional problem also. So here I will roughly just roughly explain a little bit on the period why it cause, when it will cause all those pain, and then discomfort to happen, okay, in our body. Okay, but actually I have changed I don't know why. Okay, maybe I didn't save just now. Okay, never mind. Okay, I just explain. So woman menstrual cycle, basically if you want to go to very accurate, that is 4 weeks 28 days only, not 30 days. Okay, it's only 28 days will be one cycle. So sometimes when you calculate your menstrual cycle, if you want to get a very accurate one, you should base on 28 days and not 30 days. Okay, so the date so this month maybe you start on the 1st. Okay, it doesn't mean the next month it happen will be on the 30th. Okay, it should be on the 29th. Okay, it start because one cycle is 28 days on. Okay, so maybe because you won't be able to get so accurate sometimes. Okay, so it might postpone up to 30 days because there is normal. Okay, 28 is the accurate date, and then 3 days before and 3 days after we still consider it is normal. Okay, that means 25 days or 31 days. Okay, that is normal. Okay, still considered normal. So by right the most good the most best menstrual period is basically 5 days. Okay, but okay, plus and minus 2 days, there is 3 days up to 7 days is still considered normal. So if your period is less than 3 days, more than 7 days, there is something wrong. The period might be too short, too little in volume, and then or too long, too heavy in volume. All these are due to mostly hormone imbalance is happening inside your body. Okay, so you can observe whether you have this menstrual problem, this hormone problem or not, by referring to your menstrual cycle. Okay, but of course when you have menstrual cycle disorder already, not in proper time period, then that is very serious already lah. Okay, so early stage, maybe you can refer to those other symptoms. I think some maybe you didn't mute other people's this phone this mic I can see other people talking. Okay, so so this is the times within 3 to 7 days. Okay, your normal menstrual period. If more than 7 days, might be because of hormone problem, or sometimes your this blood circulation system is too bad. It might cause all this delay, and then all this discharge, okay, of your menstrual, of your period, okay, and then it happens, making it a very long time to finish. Okay, so during this period, your hormone, okay, release of your estrogen and then progesterone is very, very low one. We can say maybe already stopped. Okay, so then if wait for the whole process of discharge of all the things, and then the extract of your what we call the how to call it the thickness of the inner lining of this vagina, okay, and then it flush it out. Okay, so after completed this, maybe after the period, maybe 2-3 days, then in your ovary there, it will start go into another stage, what we call the follicular phase. Okay, there is the growth of the eggs inside the ovary there. Okay, and then it will take a few days. So normally the release of all these matured egg out from the ovary is normally 14 days before the next period. That means 14 days after your current period. Okay, that will be the day. Okay, according to our body function, but maybe it will be slightly change because we cannot get exactly date. So maybe 4 days before the 14 days, or after 4 days. That means 14. That means 10 days after the period, or 18 days. Okay, after the period, there will be 10 days. That periods these periods normally your eggs will mature, and then it will be released from your ovary, and then it will stay in the tube there for a few days and wait for the sperms to come in, and then will be the conception period will happen. Okay, so this is the time. Okay, you will very easily get pregnant. Okay, so there is the 10 days after your period. Okay, and then up to the 18 days. Okay, this period, okay, this period is very important. So if you don't want to get pregnant, so if you are making love during this period, you must take precaution, use condom, all those, okay, to avoid getting period. Okay, and then these are the period the time where your estrogen and then your progesterone, okay, slowly will start to release again, and then of course the estrogen will get higher and higher, and then this is the period a woman will become the most beautiful woman. Okay, because of the increase in the estrogen, okay, in the body, and then the desire for sex will be very high, because this is the right time and then the best time to get pregnant. Okay, and then so the desire for sex will be very high. Okay, after this there will be around 7 days of ready for the eggs and then the sperm to join together, and then they want to settle down, okay, to find your vagina. So during this period your progesterone will release very, very high one. Okay, so in order to get all this estrogen, then progesterone to release more inside the body. Okay, something will happen, and especially during this almost 10 days where you easily will get pregnant, this period, or what we call the fertility period. Normally, maybe there will be a sudden break of the ovary to release of the eggs to your vagina there. Okay, so there might be certain amount of bleeding sometimes. Okay, that's why some people after your periods, you thought it's clean already. Okay, and then finally, or maybe on the 10 to 12, then you experience a little bit of bleeding again. Okay, that is sometimes because of the cultivating of the eggs, and then the break, to allow the eggs to come out. Okay, and then this process might cause some bleeding, and then you will experience it again, a slightly very short period only. Okay, and then so your inner lining will get thicker and thicker. Okay, during the this maybe 20 to 18 to 25. Okay, to 18 or up to 24 days. Okay, during this period, the release of your estrogen, and then your progesterone will get higher, and then you will slowly thickening your inner lining of your this vagina. Okay, and then so that it will prepare a very thick lining inside, so to let the sperm and the joining of the sperm and the eggs to settle down, and then you get pregnant. Okay, if what happened, it doesn't work, okay, no pregnancy, okay, or maybe just a young woman, okay, still don't have any sex activity, no fertility process is happening, then the body will start trying to want to go into another period cycle, so as to flush out the expired eggs. The woman's those eggs are produced inside the vagina there. Okay, so the lining of the inner lining will get thicker and thicker, and then the progesterone will release more and more. Okay, and then during this period, this time, the last week, the last 7 days, so your body will go into a stage that the body will concentrate or will get all the blood, a lot of blood will travel to your vagina there. Okay, and then the instruction, the progesterone will make all those things need to be discharged one. Okay, will come to here, and then this process. Sometimes detoxification will happen also. Some of the waste of the body will follow the blood, so the expansion and contraction of your blood vessel will be very active during this time, and then that is why sometimes if the expansion of your blood vessel is too high, not only in your abdominal area, but sometimes it will happen in your brain or other part of the body also, and then it will cause headache, okay, some of the pain, okay, let's say your back pain, okay, all these will be because of the expansion or sometimes the contraction, okay, of the blood vessel, because we want to supply more blood to your vagina there, okay, and then this will cause all the pain will come in. Okay, so until finally maybe the 27 or 28 days, because of too much of blood is settled down, and then is accumulated in the vagina there, and then the inner lining is become thicker, too thick already. Some types of hormones will be released, okay, from your vagina there to inform, okay, the body, okay, the contraction, okay, of the body, the contraction of the muscle will begin, okay, trying to push out the very thick inner lining of your vagina. Okay, there is the beginning of the process of your period cycle. Okay, and then sometimes this type of contraction will become too strong, and then it's not really controlled properly. Okay, these are the two, okay, what we call the endocrine release. These are a type of hormone also due to the thickening of the inner lining. Okay, and then it start to release this prostaglandin. Okay, and then there is another type of this what we call the hormonal release by your this white blood cell also. Okay, and then it make the muscle of your vagina there to contract. Okay, and then to cramp. Okay, and then it makes sometimes the floating of blood to your vagina will go down. Okay, so that then the whole the blood flow of the vagina there will go down, will decrease, and at the same time, it also increase the sensitivity of the peripheral nerves to pain. Okay, and finally produces this dysmenorrhea. Okay, very difficult. I also don't know how to pronounce. Okay, period pain. Okay, that is why period pain will happen because of the release of these two, okay, hormone, what we call the prostaglandin and the interleukin. Okay, you never heard before. Okay, this is the two hormone which will cause the mark near your vagina there to start react, and then contract and cramp, and then it causes the period pain. Okay, so if you want to have a very calm, very smooth period, then you should control the release of these two hormone in the vagina there. Okay, so the balancing of the hormone is very, very important. Okay, so the other factors that cause period pain, basically the first one, of course, is because of this blood circulation system. Okay, that's why normally women are encouraged, are advised not to take too much of cold drinks. Of course, men also lah. Okay, cold drinks, and then what we call those ice. Then in a environment all the time in aircon. Okay, lack of exercise, didn't rest properly, sleep properly, and then the energy level is very low, and then your temperature, body temperature is insufficient or is not good enough, and it causes a very bad blood circulation system. So this is the major cause of this hormone imbalance. Okay, because of this, sometimes it may lead to the gland, the function of the gland deteriorate because all the cells cannot get energy properly because of the this blood circulation system is not functioning properly. That's why oxygen and nutrient cannot be provided to your cells to generate energy, and then it causes all these problems. And then scientists also discovered that BMI, your BMI, okay, is related to hormone disease, hormone imbalance also. If your BMI is too low, that means you are too thin, you will have problem. A little bit slightly fat is normally will improve, okay, the problem. Okay, slightly fat. This is one of the reason, because most of the hormone are made from all the fats, like and then cholesterol, all this. They are the material to form the hormone. Okay, the hormone release. So if you are too thin, no fats, okay, the creation of the hormone also got problem. okay, and then some of the what we call metabolism is too fast, and then it will cause the metabolic of your fat and then of your protein, okay, not in order, and then this will cause, okay, the formation of all your hormones, okay, the making of the hormones will get into problems, okay, and then the third one, of course, because of hormone imbalance lah, okay, because of the higher hormone, okay, which get into problem like your pituitary gland, your hypothalamus got too stressed, and then it didn't give instruction correctly, you didn't sleep properly, pineal gland got problem, or your thyroid gland got problem, adrenal gland got problem, then it will cause all the hormone that's within how your period cycle get into problem also, then it lead to all this period pain. And then number 4, of course, genetic problem. If your of course mother, okay, mother got problem, okay, father don't have period so your mother got problem, then you may have experienced the same problem also. Then of course we don't always blame because of genetic problem lah. We take care of ourselves properly. If you have done everything, if still happen, then only there is maybe genetic problem. Sometimes we didn't do our job, we didn't do our part properly. We like to take a lot of coatings, okay, always in a very cold environment, never exercise, never sleep properly, and then always very low temperature body, very low temperature, no energy, okay, and this cause, okay, the problem of period, okay, and then sometimes there might be because of some other woman diseases, for example, like this actually I've translated this to English one. Maybe I didn't say it nicely, maybe you all can go and check, I don't know how to mention, in English the medical terms very difficult to mention one. There is the layman, we will say that the inner lining of your vagina, sometimes it didn't flush it out, okay, nicely, or sometimes the positioning, okay, of the inner lining when it formed is not in, is abnormal. Normally it is due to the flushing out of the whole things of during the period cycle is incomplete. So there are some, okay, lining still attached on the wall, okay, of the vagina, or maybe sometimes it will go to the tube there also, then it will settle down there also, or sometimes it will go to the what we call, okay, the not proper, okay, not the center of your vagina, okay, and then maybe on the side, then to front, okay. Sometimes this part, if it didn't really discharge nicely and it's still attached there, so the next period cycle, or sometimes when there is this sperm is coming in, okay, making love is happening, sperm is coming in, and then it join with the your eggs, the eggs are inside there, and then they want to settle down, then they will, okay, accidentally, okay, thought that, okay, the old lining inside there is the place they are supposed to settle down, then they will settle down in a wrong place, okay, and then this will cause miscarriage one sometimes, okay. There is this mislocation, the this settle down of the sperm and the joining of the sperm and then the eggs, and then it cause problem in the period, in the process of pregnancy, okay. We call it 子宫内膜移位, and then this will sometimes even the lining will go into our bloodstream and then will travel, sometimes even will travel up to our nose, and then it will cause nose there get bleeding, blood bleeding, and the the blood is actually from your period. Okay, then this is something a lot of women they are experiencing, and then they face difficult to get pregnant because of this problem. Okay, and then secondly, the growing of some tumor, and then maybe some seed inside the vagina, and then block the period cannot be discharged, flow out nicely, and then there might be inflammation on the 子宫颈, don't know how to call it. Okay, the inflammation is happening maybe by infected by some what we call the bacteria or viruses, or injury. Okay, when having sex, all those problems, then it causes this inflammation to happen, and then it will lead to all this pain to happen and lead to irregular discharge of all your periods. Then it will cause the delay and then the drag of your periods. So earlier we have already mentioned, okay, not only your periods problem, okay, because the whole endocrine disorders might due to all these environmental factor, physiological factor, emotional factors, and nutritional factors. Okay, just now what I have mentioned, they are all related to this, like environmental or the climate changes, the temperature changes in outside, which might cause some reaction inside the body to happen. Physiological factors, whether you are a man or a lady, or whether what stage of period cycle you are experiencing, okay, it might make the this endocrine to react in a different ways. Okay, whether you are too stressed or you are thinking too much, okay, your emotional might affect your endocrine to okay, nutritional factors, as I already mentioned, BNI, okay, factors because of your food, okay, too little of this fatty acid, okay, you might have problem also. So for ladies, go for a serious diet, because want to reduce your weight. Then you go for a weight control your diet too seriously, and then for too long period, then you might have this type of problem. Okay, when you get your weight to lose too fast, then you find that your skin to become very dry, and then sometimes pimples might happen on your face. They are indicate you are enter into the cycle that your hormone start to work in process that start to begin to become a disorder. So you must be careful if you are under the process of reduce weight, okay, and then you are trying to go for very straight and very strong, okay, this diet control, even sometimes starving, okay, stop eating, all those, okay, process. You cannot go for too long, it will affect your hormone seriously. Okay, so in order to fix it back, okay, to make your hormone to work nicely, just I already mentioned all the factors. That means if we can improve all the factors, then we can balance our hormone system in such a way, or it works nicely. So earlier we have already mentioned, in order to have a very balanced endocrine system, the first thing, of course, your blood circulation system must be very good. Okay, because if it's not good, all the property, okay, all the the hormone cannot travel, and then cannot give instruction clearly inside the body, through your blood circulation system, because your blood circulation is either too slow or is not functioning nicely, and cannot distribute all those hormone in a very accurate way or speedy way, and then the communication of the body will get short while. Okay, and then number two, of course, you must have a very strong and very stable nervous system too. Okay, because the release of all these hormones are partly affected by the nervous system also, because some instruction from your brain through the hypothalamus and then through the instruction to your nervous system might affect the activity of releasing of hormone in the brain also. Okay, because the brain will get instruction from your nervous system too. So your nervous system is not good, then the brain didn't get the instruction nicely. Also, it will affect the process of releasing all the hormone too. Okay, so this is the second point. We want to fix it, and then the main point we want to try. Number three, of course, you must supply your body sufficient nutrient, okay, to make all these hormone can be make up, okay, and then the gland can be nourished, okay, nourished by all these ingredient, okay, and then maybe the repair of your cells of your gland can be rectified by supplying sufficient, okay, nutrition to fix it. Okay, only then you would be able to have a very strong improvement, okay, on the stability of the release of your hormone, and then a stable endocrine system. So in vantros, we recommend the use of IM laser and CV8 because these two fulfill the requirement, because the use of IM laser physiologically, okay, the use of IM laser can improve the body's blood circulation system, and then it will increase the metabolism. That means the generating of energy inside the cells to make the cells to have more energy, to increase your temperature, okay, and then to increase all the enzyme activity inside the body, so that the increase of your energy inside the body will be upgraded. I think someone's mic have to be off. Okay, otherwise when we record it, we'll record your sounds also. I don't know from where. Okay, some okay, some of the member they didn't off the mic. Okay, okay, so I'm laser. First one, okay, you improve your blood circulation by providing a light, a 650 nanometer visible red light, which the scientist has already confirmed and discovered and confirmed that it will bring a lot of benefit to our body, and FDA approved medical device, okay, used to create a light, and then using the high technology of this laser to penetrate it through our wrist, and then go into our blood, and then it will stimulate all the enzyme in our bloodstream, and then create and induce the activity of all the enzyme activity in the blood and then in the cells also. Okay, and then all this enzyme activity will stimulate the cleansing of the blood cells, especially your red blood cell, which might be attached by a lot of minerals or a lot of nutrition like your fats, your protein, or waste, or those toxin waste. They might have blocked the electron on the red blood cell, and then cause the red blood cell sometimes easily attached together, and it will affect the blood flow, okay, to get very slow, and indirectly it affect the delivery of oxygen and nutrient to the cells. So it will cause a very slow blood circulation system. Okay, so the light 650 nanometer light, okay, created by IM laser, okay, will activating all the enzyme activity in the blood, and then it will cleanse, okay, the blood cells, and then the blood cell finally the electron can function nicely, and then it would attach together. So the blood flow will increase, the viscosity of the blood will improve, and then the supply of oxygen and then the nutrient in the blood to the cells will increase too. Okay, so it improve blood viscosity and promote better blood circulation. So the blood, the photon provided by the light, okay, will attach on the red blood cell and distributed to the whole body, and then it will enter to our cells, and inside the cells, okay, the production of your mitochondria, okay, to produce this energy need this photon to activate the enzyme inside there. So the light, when it enter, okay, when it reach the mitochondria, okay, you are activating all the oxidase type of enzyme inside there, and then it will speed up the process of making the energy which is supposed to be done by the this mitochondria by using water, oxygen, and then the nutrient that we supply to the cells. So the activation of the oxidase will speed up the process, and a lot of this energy will be created in the form of ATP, which will make your cells to begin to have a lot of energy. And then once the cells is full of energy, the cells can run its function nicely. The metabolic of the cells will begin, expel of toxin will begin, and then absorption of nutrient will be better. And then we know that the whole organs inside the body are made of cells. So the strengthen of the energy of the cell will strengthen the organs, and then the performance, the function of the organs can be carried out nicely, and then the long-term improvement, okay, can improve all these organs, especially when we refer to endocrine. We are talking about all the glands will be improved, and then if related to the gland, sometimes we might do some target treatment on the gland also, like our forehead, our this top of the brain, okay, all those we are trying to give a lot of light to the brain, okay, to reach the brain, to activate the brain cells, and then to activate all the cell in the all this gland there, so that the gland function will restore back, and then the gland can perform better. Okay, and then all this will make sure the whole body is connected and communicated, okay, nicely, and then with the help of IM laser to improve all the coordination among various body systems to strengthening the neuron function. The neuron cells will be improved by using the IM laser. Okay. So on the other hand, in the process, okay, so here from here we will encourage, okay, if those who already have some problem want to improve on some illness, or maybe they are under sub illness level, okay, they must first of all improve their sleep first. Okay, so by having a very good gland improvement, especially the pituitary gland and the pineal gland, for sleeping, the pineal gland release melatonin, which will improve our sleep in a very good way, and then induce the release of pituitary of the all those growth hormone under pituitary gland, and then this will finally affect all other gland inside the body. Okay, so a good sleep is very important in restore back our endocrine system. Okay, so you must remember, if you are hormone imbalance, you must first improve, okay, your sleep first. Otherwise, it's very difficult to tune back your this hormone imbalance. So these are the food which you have to take, okay, in order to increase your serotonin. Your tryptophan is very important. These are the food which are very rich in tryptophan. You should eat more, okay, in order to get a good sleep. And then just let you know, CVA also contain very high this serotonin and tryptophan, which will promote a very sound sleep. That's why after taking your CVA, okay, you'll find you will get easier to sleep. And if you join, okay, with the use of IM laser, of course, the effect will be not to say 1 + 1 = 2. It will be maybe equal to 11 or maybe infinity. It will change a lot if you combine when you use together, and then it will help to release all these happy hormones inside the body, inside the brain there, okay, and then eventually it will control, okay, and then influence, okay, the release of certain hormone in your hypothalamus, okay, to secrete secrete certain hormones to your pituitary gland. So eventually the whole hormones will be affected. Okay, so a good sleep will improve all these happy hormones also. So we must do it nicely first, okay, and then all the ingredient, okay, super antioxidant inside the CVA can help to protect all the gland, all the cells actually inside the body, and not only the gland itself, but antioxidant will protect us from free radical attack inside the body, and then eventually it will help protect all the cells, okay, and then the gland, and then mostly all these what we call the CMC stem cells or phytochemical inside the stem cells, wild ginseng stem cell. Some of it, the ginseng nut side, can effectively promote the stability of the nervous system and balancing the secretion of hormones also. These are proof and certified by a lot, so many organizations. Okay, the World Organization already certified that this wild ginseng, ginseng nut side property can help in this way to come down, to strengthen the function of our nervous system, and then high content of minerals in the CVA, and then other vitamins, okay, can effectively stabilize the nervous system too. Okay, so by the use of CVA, okay, it can further, okay, to stabilize all the nervous system in the body. So the communication system inside the body, with the use of IM laser and CVA, it will strongly be stabilized, and it will start balance up the release of all the hormones inside the body, and then helping to create all these happy hormones in the body. Of course, if you want to further enhance the release of all these hormones, okay, you can follow all these activities. For example, like endorphin, it will be created more after you exercise. Okay, after exercise, it will be created a lot inside the brain there, and then dopamine. Okay, if you what we call fulfill some achieve some target, then you have that kind of feeling, the kind of fulfillment feeling. That is because of dopamine is released, okay, after you achieve a certain goal. Okay, so every day make some small goal, and then make sure you fulfill that, and then you will feel more comfortable by the release of your dopamine. Serotonin, okay, with appreciated a very kind gratitude heart to do something and to help others, and to what we call to lead, benefit others, then the kind of satisfaction that you will have, there is the release of serotonin inside your body. Okay, so try to be useful to others, and then to hug your family members or your friends, okay, when necessary, when that's why sometimes when people feel very sad, we will use a very big hug to comfort them, because it will lead to the brain to release the oxytocin inside the brain to make you feel released and then feel comfortable, okay, and what we call the stress will be released off. Okay, so you can in the use of beside using eye laser in our standard use, the nose and the wrist there, okay, you can also combine it, okay, when you are facing emotional problems, or maybe your hormone release become hyper inside the body. For example, you are experience hyperthyroidism, or you are getting very nervous, and then anxiety, and then weight loss, then you very difficult to sleep, very difficult to calm down. Then you can do some of this exercise before you sleep. Okay, so if you have serious insomnia, I will encourage you to combine with this few exercise: point toe, flex toe. Okay, just sleep on the bed there. Okay, these flex toes, and then do some exercise like this splitting leg. Okay, stretching on the muscle of the leg there to make your muscles experience tension and then release, tension and then release. Then it will make your muscle to release from tension, and then you will get what we call very smooth. Okay, it will get smooth and smoother, and then release all the tension, and then it will influence your your nervous system also, and then slowly the relaxing will happen in the brain too. Okay, so before you sleep, maybe you can do a little bit on this. Okay, stretch on the left and the right, and then on the middle. Okay, so to give a good stress on all the muscle, and then the those gan okay. Okay, in the abdominal or in the leg there. Okay, and then if after this, maybe you can do a V support. Okay, where you use a lot of strength on your abdominal, okay, on your core there. Okay, and then this hold there for a while, okay, until you cannot stand, and then you release. Okay, then maybe you feel very relaxed, and then you will go into sleep. Okay, so these are some of the exercise maybe you can do, or before you sleep, maybe you can do slightly maybe a 5-minute meditation, or practicing inhale exhale nicely, a longer exhale, okay, compared to inhale, so as to relax your mind, or longer exhale will comfort down you and relax down you, and then start to do all the exercise that I proposed to you earlier. Or maybe if you don't want to go for so hard one, then you go for doing all this deep breathing technique. Then after that, do a V support, then relax your mind, then maybe you will go into sleep. Okay, so for those who are having difficulty to relax, and then maybe some people might have hypertension, and some before you sleep, maybe you have done a lot of work, and then you cannot calm down your brain. Okay, so I will encourage you, you can sit down and then do some meditation, breathing technique, okay, or lie down, like the diagram just now I showed, and then you put your your arm laser on the back at this 凤池 okay, 凤池穴, okay, here, and then the line you can use on the 太阳穴 here. Okay, so these two are very relaxing and reducing your blood pressure very effectively. Okay, and then you may do some slow massage on the forehead here. Okay, so this is the part to release tension. Okay, in the brain here, in the head. Okay, especially, and then especially the middle of this two eye side, two eye in the middle part of this part. Okay, so you can massage a bit. Okay, and then put on your arm laser here. Okay, start to do your meditation and then your breathing technique. Okay, for about 15 minutes. Okay, if let's say then start to lie down and then put your arm laser on top of the head. Okay, the 百会穴 here. Then the line put the round cap and put on here. Okay, the 印堂上面 here 啦 Okay, the middle of the eyeball here. Then close your eye and then you lie down. Okay, and then keep on doing your breathing technique. Okay, until you go into sleep. Okay, so this is the process. A very effective way to relax down the whole body. Okay, so if you are facing thyroidism, okay, you can practice this. This is a way to help to relax down the whole body. Okay, this is a very good way. I quite often I practice this. Is eventually help for you to get a better sleep, and sometimes it very effective to reduce your high blood pressure also. Okay, so what happened? What happened if you experience like hypothyroidism? The release of your thyroid is too low, or you getting very easily get tired and then very lazy to exercise all those. Okay, when you use arm laser, okay, of course you must combine with some of the cardio exercise. Okay, that means you try to use your arm laser when you do exercise. Okay, and when do exercise, try to use some exercise which needs some strength one. Okay, so to increase the need to create energy inside the body. Okay, so this eventually maybe will help to motivate, to promote the activity in the all the gland. And then of course you can do target treatment on the gland. Okay, for example, like hypothyroidism, you can do directly on the neck here, front neck. Okay, on the gland there. Or if you want to improve further, you can do all these points. All these points are helping to have a hyper release of hormone in the body one. Okay, you see, okay, at the back here. Okay, this is the point. Okay, opposite of the 印堂穴 this at the back. This trying to get more energy or more light to be able to reach your hypothalamus. Your pituitary gland. Okay, at the back, the pituitary gland. So you can put it here, and then here you can put also. Okay, this will activating. Okay, some of the activity in the stomach. Okay, and then eventually connected with your what we call the thyroid in the meridian point. And then these are the few points which will help to improve the increase of hormones, okay, in the body. What we call this is the point already designed in the arm laser. Okay, this heart meridian, and then this is a point which will affect the liver meridian. Okay, you can find it out, and then when you do you can, maybe you have time, you can do especially this point. This is the point whereby the connection of the liver, spleen, and then the gallbladder, three meridian line, they will join at this point. We call the 三阴交. Okay, 4 fingers are above your ankle here. Okay, this is the point whereby you can do. This is a very, very important point inside the body. Okay, so maybe you can try if you got time. This all small all one point. then you can target.
Nói cái này dùng không à?
Okay, so this okay, so what happen if you are having those period problem? Then this target point that you can apply beside the standard treatment on the wrist and then the nose there. Okay, so at the back, okay, this
Có
part.
chuyện này họ mang à?
Okay, so you can
Họ mang
directly
nghe à? Yeah.
Okay.